अच्छा, तो अब हम देखेंगे, रिव्यू करेंगे रेस्पिरेटरी और पल्मोनरी फिजियोलॉजी पे। फर्स्ट ऑफ ऑल वी विल डिस्कस द एम्ब्रियोलॉजी ऑफ रेस्पिरेटरी सिस्टम फ्रॉम फर्स्ट एड बुक फॉर FCPS, USMLE, UKMLE, PLEB and whatever exam you are trying to pass. This book is Bible of all the medical uh, postgraduate exams. So respiratory pulmonary embryology starts with lung development. It occurs in five stages. Lung development occurs in five stages. So, begins in the formation of lung bud from distal end of respiratory diverticulum at the fourth week of development. Now, fourth week of development, lung bud starts developing. As you can see here, lung bud is formed and that goes down into formation of trachea and the bronchial buds. These bronchial buds give rise to the mainstream bronchi, and then secondary lobular bronchi and tertiary segmental bronchi comes. So this is the lineage and the flow of embryonic week from fourth to seventh development of lung bud, and then it goes down to the different stages of the week from 4 to 7. As you can see here, lung bud is there, and then it goes downward into the segments, and then bronchi, and then tertiary segments, and then in this way it keeps on dividing, and it keeps on forming the terminal bronchioles, and then respiratory bronchioles, and then alveolar ducts and surrounding capillaries, and then terminal sacs, and then septa, and then type 2 pneumocyte for surfactant production. So in this way alveoli are formed. Now there is a term that is conal atresia. What is conal atresia? It is blockade of posterior nasal opening. Atresia means failure to canalize, often associated with bony formation, abnormal midfacies, and most of the unilateral. When bilateral, it is emergency, present with upper airway obstruction, noisy breathing, cyanosis because of the hypoxia, worsening during feeding, and improves during crying, diagnosed by failure to pass NG tube and beyond the pharynx and confirmed with the CT scan. So in this way we can diagnose the conal atresia. Now conal atresia often part multiple malformation syndrome like coloboma of eye, heart, atresia of cornea, restriction growth, and genital urinary defect and ear defects. Okay, so